Hey everybody, so welcome. I've got a really special person with me today who I'm going to let her introduce herself because she's a very special guest, last minute guest, I must admit, speaker for the Great Big Yawn Mental Health Fest on the 10th of November. And she's going to be bringing holistic and functional medicine to the core as an ex-NHS GP. So please do come and introduce yourself, my darling.
So I'm Dr. Ailsa Care. So I was an NHS GP for almost 30 years before retiring last year. So I now work in a functional medicine clinic. So we're a collaborative care team, we call ourselves, because we have two ex-GPs. We also have a consultant psychiatrist and a consultant endocrinologist who are trained in functional medicine. We work alongside a nutritional therapist and a health coach. And every week we have our collaborative care team meeting. So we discuss all our patients that come through the practice. So, you know, any patients that are on board with us, they don't just get the insights from one clinician, but they get the insights from the whole team, which is amazing. So we do have a special mental health pathway as well that involves our consultant psychiatrist. My other work is in a bioidentical hormone clinic. So I'm dealing with women from early 20s right up through menopause. We have some ladies who are maybe in their 70s that are taking bioidentical hormones. But we approach it from a more holistic perspective, bringing in the elements of functional medicine. So looking at the lifestyle factors, looking at the underlying root causes of why women have a hormonal imbalance, and empowering them to be their best selves, really. And one of the reasons I'm so excited to be involved in this is because, you know, perimenopause particularly is a time when our hormones are changing, and it can really tip the balance, especially in terms of mental health. And a lot of women's experience is that they'll go along to their GP because their mood is imbalanced, and the first thing that will happen is they're given a prescription for an antidepressant, which isn't necessarily what they need.
Yeah, absolutely. And I'm so excited that you have come on as an example of how we all, I think, want medicine to be moving towards, so that we've got that whole approach of everything being taken care of, not just that one particular symptom that seems to be honed in on, or a name that is being given to maybe something like IBS, but actually has so many other things and factors that are connected to the reasons behind, the root cause behind somebody's IBS or whatever it might be. And for us all to be coming together under the banner of the Great Big Yawn Mental Health Fest to show what is actually available as an alternative to the NHS, which is literally crumbling around us as we speak, the capacity for care, as you know, being, you know, in the NHS for such a long time. I think the burnout that must be happening behind the scenes really must be quite scary, I feel. Can you give us a little bit of insight of that?
Absolutely, because I think my journey into working more holistically was through my own ill health, and I know that I was burnt out. Although it manifested itself in some quite physical symptoms, you know, crashing fatigue and brain fog, and some neurological symptoms which nobody could really explain. And I think, thinking back, probably my hormones had started to change. And actually, when I did my training in functional medicine, at the conference, we were all given an adrenal stress test. So we were checking our salivary cortisol levels at 4 points through the day. And you're meant to have a nice morning peak, and then it's meant to drop off through the day. And a few of us were reflecting about this recently, and we all had flat lines. You know, our adrenals were burnt out.
Yeah.
So, you know, first of all, you get a heightened adrenal response. So you might find that your cortisol levels are high at certain points in the day. But then as time goes on and you're draining your adrenals more, you literally can't mount that cortisol response. So, you have no motivation, you have no get up and go for the day, and yeah, you just feel completely flat.
So what other effects would that physically give you apart from the not having that get up and go? What other symptoms might people be able to relate to with that?
I mean, often fatigue. So you often get a chronic fatigue type of picture, sometimes even a POT sort of picture where you feel that your heart races and your blood pressure drops when you stand. So you might feel dizzy and a bit weak. Just and low stress resilience. So anything overwhelmed very easily, crying at the drop of a hat.
Yeah.
There's nothing left in
Yeah.
the
So
bag.
yeah. So those are the symptoms that I deal with from a burnout point of view, which sort of covers, I suppose, most titles that we come under from a medical point of view, because we sort of work on those from an individual aspect of each symptom and help to eradicate those out of the emotional trauma that's attached to them, which actually then has a physical, seems to have a massive physical effect on people. Hence the title of the Great Big Yawn Mental Health Fest, because I think, as we both now know, with the alternative approach that we're taking, there has to be a sorry, did we freeze there? Did you manage to
You
catch that?
first for me.
Pardon? Did you manage to catch that?
You were talking about the yawn. Yeah.
Yeah, so how does the Great Big Yawn, the title of the Great Big Yawn, actually relate to what you're doing now, the work that you're doing now?
Well, I think if I'm right in saying that it indicates that the vagus nerve has been activated and it demonstrates the relaxation response. Is that right? So when you yawn, you're activating the vagus nerve.
Yeah, absolutely.
Yeah.
Absolutely. So it's actually having a real effect on connecting our body and mind together, which is what most people are suffering from, because they're either totally immersed in their body and they can't escape from it, and it's overtaking their head and their thoughts. And but actually, when you can start to separate it just bit by part by part by part, and actually bring yourself into some coherence with it, really magical things start to happen. Like your tone of voice starts to drop. Just me talking about it, my whole mannerism now has actually started to soften as I go into that remembrance, and it is a remembrance of literally what that feels like and looks like and smells like and tastes like. And as you sort of go into that process, it's a really softening process for the body. It's a gentleness that alleviates tension, because everything that you've related to about the adrenals, it's all about that huge some space to move.
Yeah. Yeah. And we talk so much about the vagus nerve in terms of
Okay, so I can't wait. Yeah, we're losing the reception here a little bit. Whether that's because I'm in the car park at the Red Hall Hotel, I'm not quite sure. So we're going to cut this short, because there's an opportunity for you to come and meet us in the flesh, face to face, at the Red Hall Hotel, and it's going to be an amazing day. There's going to be so much value, so much information, so many useful contacts and connections for everybody to come and establish on the day, because it's when you're in these type of places and environments together that something really unique starts to happen, and that's when the creative juices start to flow as to how we can move things together as a bond, as a unity of businesses, of creatives, of individuals, of families, all of that holistically moving forward together. And if we can do that, the possibilities of what we can be as a human race is really quite startlingly beautiful to even comprehend and think of. So thank you very much for joining us, Ailsa, and we look forward to seeing you on the day, and catch us also on Facebook because I've been on there. Okay, folks, we'll see you soon.
Thanks a lot.